Well, we're here today at the 7th Annual Community Oncology Conference, and we've just held a very lively luncheon discussion. Christian Downs from ACCC seated to my left, to my right, Sarah Walters, who's representing AmerisourceBergen and Walters Consulting, and Matt Brown, my friend, who's from US Oncology and McKesson Specialty. So what we wanted to do is just have a little chat about one of the topics that we discussed. It's very topical now, which is drug shortages. And so I'm going to bounce it over to you, Christian, and say, what do you think is causing these drug shortages? You get a lot of emails from everybody from the academic community to community oncologists saying, what's going on here?
Yeah, well, it's a complicated issue, Ted. It's not a simple issue. I think that one of the core things we certainly see with this is an economic issue, and that is regards to the pricing of these products. It's complicated, sophisticated, but I think one of the interesting things that we need to look at this, and one of the things that makes it illustrative, is of some of the unintended consequences of some policies that have taken place. Really, if you think about some of the policies that have taken place, it was an attempt to address expenses at the top end of the drugs, and what it really wound up hurting was the drugs at the bottom of the end, and concerned about how that's going to continue to have access issues down the road.
Matt, how do you see this playing out with your physicians, part of the US Oncology Network? What are you hearing? What do you see happening here?
Sure, everybody's really very much in a difficult place when you've had drugs for decades that work for patients and are inexpensive, and all of a sudden they're just not there anymore. And that's very disconcerting for oncologists, and obviously even more so for the patients that are having a hard time finding the treatments that they need. We've been working hard from a business perspective, and also we're hoping that from a policy perspective there'll be some progress on this issue as well.
So Sarah, you've spent a lot of time on Capitol Hill, actually working for Senator Breaux. So why don't you give us an indication of what you think? Is Congress going to fix this? Are they going to do something about it? What happens?
Well, in a year when we don't think much is going to happen legislatively, I think this drug shortage issue is something that Congress really is trying to get done, and there's bipartisan agreement that there's a serious problem and they need to address it this calendar year as opposed to waiting until after the election, which is when a lot of health care decisions or debate or legislative will take place. And again, I think the good news is there's a bipartisan agreement that this needs to be fixed. There's bipartisan work to try and draft a bill. There's clearly an agreement that there's a lot of issues involved here, a lot of factors contributing to drug shortages, but clearly economics and pricing, particularly of generic injectables, is one of the most critical issues we need to get fixed. And I think there's a lot of optimism that it's going to happen this year.
Well, I just hope it's a great point that you make, that this is a bipartisan issue in this Congress where everybody, right and left and, across the aisle, I mean, they're arguing. I think this is something that's really good. I think my biggest concern is that they just don't take the easy road out, which is they address sort of the symptoms that we think are involved with this, which are the manufacturing problems and all that. Matt, you made an excellent point. I think that we're narrowing down our manufacturing base, so when one facility or one production line goes offline, that affects and that creates a drug shortage. I just hope that, and I know Senator Hatch is, as we all know, working on a bill that actually includes a pricing stabilization component, which is really, I think we all agree, sort of at the root cause of this. So I think that hopefully Senator Hatch and we get bipartisan effort in terms of actually fixing not just the symptoms, but the root cause of this.
Right.
And Ted, I'll just add, I was struck this year about how this drug shortage issue really came from the ground up. I mean, this is not something that Congress just kind of happened upon. They really heard from their community oncologists and others about how critical this shortage is and how it was affecting patients. So that was really, really impressive in terms of getting Congress's attention, getting them to this point where they're about to hopefully fix it legislatively.
I was surprised too to see how affected people across the board. It wasn't just a small practice in the middle of of Iowa. It was hitting large practices, small practices, hospitals in the Northeast, Southeast, Midwest. It really had impact across the country.
Yeah, I think what's really important here, and everybody should know, and we'll sort of wrap this segment up, and how important it is for individuals out there who are impacted, whether they have cancer themselves and can't get a drug, whether it's a loved one, to reach out to their members of Congress. A lot of times people say Congress isn't doing anything, they can't get anything done, but I think in this case, the reason why Congress is getting something done and trying to do it, and it's bipartisan, is because they're hearing from their constituents. It probably helps that it's an election year, but I know there are many members of Congress who themselves have either had cancer or survivors, or someone in their family is, and they're sensitive to this issue. So I thank you all for weighing in, and we've had a lively segment here, and not only in terms of the drug shortages, but a lot of other topics. So thank you.